We are on a mission to save and revitalize independent pharmacy. On the Catalyst podcast, we dive into current events that are shaping how pharmacists approach their patients and their businesses. Fuel your passion for pharmacy, one conversation at a time.
3, 2, 1, 0. Ignition.
Welcome to the Catalyst Pharmacy Podcast. I'm your host, Jeff Key, president of PioneerRx. Today, I'm here with Mark.
Hi, I'm Mark Bivins, vice president of sales for PioneerRx.
Today, we are here with Vicki Einhellig, CEO of Good Day Pharmacy in Loveland, Colorado. So what the heck's going on? This is a crazy, crazy world we're living in. I get pharmacists texting me at 3 o'clock in the morning because they just finished entering vaccinations from that day.
Sure. I kind of wonder really what we did last year or before this year. We must have been so bored. I mean, the whole pandemic has just added an incredible layer to everybody's kind of life and world right now. So for us, kind of the same as everybody, we went through a lot of changes at the beginning of the year. We closed down in March, actually April to June. We closed the front of our pharmacies and did a delivery model to the parking lot. So just again, going through sort of all the different phases that we've all gone through as a country and a world, just kind of facing the unknown together. We had a great year though. That's good. We were up higher in sales than we have ever been.
Wow.
So, which is pretty incredible when you look at what we, with being closed down for 2 months, at least in the front of the store. So things are, I feel things are looking up. I feel good about the vaccine being out and available and more available, right?
Yep.
We're able to participate in that right now too. So that's been really exciting.
On the you said you had like your best year ever in 2020. Would you say you that lends itself to, because you guys do so much like clinical services wise and all of that. Do you think some of that helped insulate 2020? Because we've had some people say otherwise.
Yeah. Where did the money come from? You said you did great.
Yeah.
You had your best year.
Yeah.
Where did it come from?
Well, so that is such a great question. And what we did this year or last year, is we use the 4 disciplines of execution structure, and we focused, we set a goal, and we set a goal to increase our sales by 11.5%, which is a super lofty goal from the beginning of the year. So January 1st and through December 31st, 2020. And this was all before COVID.
Yeah, before
you set those goals before that, and you're like, oh wow,
right. And so we really we set that overarching goal, and then with our teams, we set individual goals with the teams. A lot of it was focused on MedSync. Nice. So right there, you're getting a good lift with sales with MedSync. We had goals around immunizations. And the teams at the locations, they were aggressive. They set goals. And with that, I'm not sure if you guys are familiar with the 4 disciplines of execution, but there's setting a goal.
Tell us.
Identifying the lead measures. Okay. So identifying those action items that you're going to do, having a scoreboard, and then holding people accountable or holding your teams accountable, holding each other accountable. And that is exactly what happened. That's how it happened. We just were very intentional about those goals, and it was a lot of fun. It was a lot of really good communication with the teams, and everybody likes to win, right? You like to win.
Yes.
Yep.
Who doesn't like to win?
Who doesn't like to
so
win?
It felt like that was really motivating for everybody to feel like they were winning.
All right. Did that? So you had this overarching goal of 11.5%. I'm going to call it across 10 pharmacies. Am I right? 10? Is it 10 total?
Yes, and we 10, and we just added an 11th location. We just added a central pharmacy, so we have 11.
All right. Was there a pretty rigorous process, each location, of drilling that down to something that's a little more tangible or activity based for that particular role in your pharmacy, like your MedSync tech or your people that run the clinical side with the immunizations piece?
Yeah. So each team came up with their own goal, just to point toward or to reach that 11.5%. And it was something that, and that's an important piece of the formula, is for the team to decide their own goal, because then they're going to be more excited about something that they've chosen. And then exactly what you're describing, Mark, it was broken down into pieces. So if the goal is to increase MedSync by 20%, let's say, then what are the steps that have to be done on a weekly, daily basis to get to that? And it breaks it down to conversations, right? Getting people enrolled. I mean, just breaking it down into something that is you're able to do on those weekly cadence or daily cadence.
So what did that motivation, besides it, was there anything besides just winning? What did that motivation look like in those teams?
Yeah, I mean, we would celebrate. Like, we would have certain marks that if you hit a certain amount, like we had one at the end of the year around Medicare enrollment. And it was if they had a certain number of enrollees, and you don't necessarily see if they actually enroll, but there was, if they were able to hit a number of conversations and providing information out to those potential patients, then they would get a lunch. I mean, we would just do something again to celebrate just the small victories and those that would hit those marks. So yeah, I mean, again, just trying to make it fun and trying to keep everybody engaged so that everybody is contributing to moving forward. There's so much whirlwind in pharmacy, and so much that you're having to do. Being able to focus on a goal, just really, and having one goal, because we're like every other pharmacy, right? There's so many opportunities. And I think one of the biggest things that we did to be able to focus on that is to almost say no to things that maybe are still good opportunities. And I think that was the key. It was really a fun year.
Jeff, you always say a lot. It's just as important to know what you're going to say no to than it is to what you say yes to.
I mean, I think it was who's the rich guy with the Coke? He's a very
Coca-Cola.
Yeah.
Okay.
He drinks Coke.
Just making sure.
No, I'm trying to think of who I'm thinking of. It's the big investor. He's friends with Bill Gates.
Buffett?
Yeah, Buffett. One of his big sayings is that success in business is more about what you say no to than what you say yes to.
And it's hard to say no, right? Especially if something is like you feel like you're going to be at the front of it, it's cutting edge, or it's a big opportunity. So it's just prioritizing, right, and seeing what makes the most sense. The other thing that we did is we looked at our mission statement, and we wanted it to be, and we did change it. We changed it at the beginning of 2020, and we really wanted it to be something that everything that we worked on could point to that. And so our first sentence of our mission statement is that we believe the best healthcare is based on relationships and delivered locally. So it kind of has two really important components, and relationships internally, and relationships with our patients, with our providers. And again, that was just something that it's easy to remember. It's something that people can rally behind. And again, when we make decisions on what direction we're going to go with different projects, we kind of look at it and does this point back to what we know why we're here?
So what's our 2021 goal? So 2020, in the absence of knowing all this was coming, we set 11.5%.
23%.
Right. Okay. And so what's our goals for 2021?
Yeah, great. So our goal for 2021 is to increase patient growth. So net patient growth by 25%.
Define. Can you define a little bit net patient growth? Is that new active patients, or is that something else?
Yeah, so it is. It's new active patients. Okay. And right now we're going to have to base it on prescriptions. Okay. We'd love to be able to do more with the front of the pharmacy, right? I mean, we've started with the loyalty program that is available through PioneerRx. but we're looking at growth in prescription transactions.
Right. So this is
by
25%
patient.
in
Patient.
patient prescriptions or patients. Which one of those is actually patient
So
count?
it's actually patients.
It's actually
Okay.
patients
Not
based on prescriptions, right? Right.
Yes.
Yeah.
Exactly.
New patients getting
Thank you.
prescriptions, right?
Right.
Thank you. Yes.
And so
exactly.
what will we call an active patient?
So we're going to have it be patients that get regular prescriptions, not just one here and there.
Okay.
And I believe we have just an incredible operating officer, Joseph Poling, and he is a whiz at PioneerRx. And so he's identified a report that will work for this goal so that we can track it and be able to, give that feedback out to the teams.
So you had a goal of 11.5. You made it? You hit it?
Yes, 11.59.
Gotcha. Oh man, right.
Nice.
You really managed to it, dude. That's the thing that goals help you do.
I know.
You
It's
manage.
like
It really gives you something to manage to.
Yeah.
And we
No,
do
it
that in
was great.
sales. Jeff's instilled that throughout the entire organization, so it's great. We have goals. Jeff's even done keynotes on goals.
Yep. We have a new dashboard that's in PioneerRx that rolled out.
Oh yeah.
A beta of it last week rolled out
that might help
this week. So email me the specifics of that. Let's see if we can get it in there. Because that way
Okay.
they can just hit a button and see
Oh, that's perfect.
how they're doing. I know it shows new patients today.
It does. Yeah, it does.
And new patients last week, compares it to the week before.
Is it
Okay.
running that historical data though? Like, because it's some of that data is this point forward because we weren't recording some of it, but some of it is historical.
Yeah, I've got to figure out what we call an active patient.
Yeah.
I think we just call an active patient somebody who's gotten a script in the last 4 months to handle 90-day supplies.
Right.
And that's where we look as
that's
active
great.
patient and active patient growth. So if you use that as your measure, we might could tweak those where they wouldn't have to wait on a report in the store. They could kind of look at that in more
On
real
the
time.
dashboard.
Yeah, it would be fun.
That's great. And I feel like even with the onesies, even if it's somebody that comes in to get something that isn't typically, that's an opportunity for us to show off, right? A lot of independent pharmacies, their patients or customers will walk in and it's almost like, they didn't know that they were there. But of course, once they experience that service and they have that experience, then they're going to come back. So
Yeah, our Red Cell CEO, Craig McEwen, mom, totally unprompted, switched to an independent pharmacy during all this because I don't know, whoever she was using, Rite Aid or Walgreens or somebody, was just horrible trying to get vaccinated.
They were screwing up vaccinations. No offense to any Rite Aid.
And she switched and is going to go to an independent pharmacy now. And so, one thing you think about with all these independents doing vaccinations, there's just going to be huge, and COVID testing. I think you're doing both, right?
Yeah.
The huge marketing database of people now.
Yeah.
If you can impress them in that experience.
yeah.
And it's kind of interesting what impress them means. I was talking to a pharmacy the other day, and impress them to them meant seeming big. So they were really in their text messaging trying to find their messages of how your COVID test was and this kind of stuff, trying to sound
big or
big.
advanced. You mean like advanced?
Advanced,
Okay.
very formal.
Yeah.
And my point to them was, this is your opportunity to be independent. This is your your
different.
chance to shine how you're different, right? Don't say we have your COVID results are negative. Click here for more. Say, hey, Mark.
Hey, Pete. Yeah.
Yeah. Hey, Pete. Right. This is Jeff at the pharmacy. You'll be happy to know your test came back negative. Or, hey, we're sorry, but your test came back positive. Here's some ideas. And if you have any questions, text us back at the pharmacy. Right. This is an opportunity to
build those relationships,
right?
To really connect with people. And that reminds me, when we actually have started vaccinations, COVID vaccinations, and when we first started, we have a jot form on our website, and so we got that rolled out. But that's all new for us and for everybody. And when we very first started, the actual scheduler wasn't working, so people would sign up and they'd filled out the form, but they didn't get a time, and which was a little panic there. but what our pharmacist did, our pharmacy manager did, and it was fixed quickly, so it wasn't too much of a problem. But she called each person and coordinated with them and made sure that they had a time. Just made sure that, because of course they're very eager and anxious to get a vaccine. So just having that reassurance that they did have a time was just great. And they got a lot of, Lori got a lot of positive responses from patients on that.
How is the allocation working for you guys?
Our vaccine allocation is driven by the county. And early on, when I was more just wanting to make sure that our teams could get vaccinated, because I knew we weren't going to be receiving the Pfizer vaccine, I knew we weren't going to be in phase 1.
Right.
We connected with all the counties in our areas. We have 3 counties that we have pharmacies in, and so that was the initial kind of reach out and just communicate and have that relationship built. And then one of the counties, we ended up being able to get our teams vaccinated. And one of the counties reached back out to us and said, hey, we need help. We need help capturing our healthcare professionals. And in Colorado, it's 70 and older is the first phase, or 1A and 1B.
Okay.
And so that's how it's working for us. Every week we order through the state. And we find out, in fact, we find out tonight, we find out every Thursday night at 6:00 if we have received allocation. So
not to trivialize it, it's kind of like the lottery. It's like,
yeah,
you gotta watch it tonight.
Or maybe, hopefully, they're deciding based on how good they did with the time before.
Yeah. Do you feel like they've got it? Do you feel like the state's got it together there, at least? Yeah, mostly?
I think so. I mean, it's,
heard some
let's talk good about them right now because they're allocating
That's true.
vaccines. They're doing great.
Lisa,
they're super responsive, and I know they have so many things that they're juggling. They do have a set way that they allocate. I mean, the hospitals get 50%, and then it's broken down into the pharmacies, providers, that kind of thing. So it's great. We're on a vaccine call with them every week with the counties, and then we're also participate in the state. So I feel like there's good communication, and
that's good.
And they're transparent about it. So
now do they have the freezers? They have a hard freeze, and then they pull them out to you guys, and you'll have 7 days to use them. Is that the?
Well, so now that the Moderna vaccine is available, we have freezers. You have to have a regular standalone freezer to even be able to get Moderna vaccine. But really, you get it. It's good in the refrigerator for 30 days.
30. Okay.
So
I didn't know that.
We're not even putting it in the freezer because we're turning it around that quickly. So we did a clinic setting, and then we'll probably do a combination. We're crossing our fingers that we're going to get vaccine this next week, and we'll do a combination of a clinic setting and a drive-up clinic, and then also work it into the workflow as well.
Will the drive-up be on site, or will it be off-site?
On site.
How quick you think you burn through it? How quick are you burning through them now? Is it like a day or two and it's already gone?
Yes. Yeah. So we can probably do 30 a day in workflow and 100 a day if it's a clinic
at
base.
a clinic. Yep.
Yeah.
That makes sense.
Good.
Huh.
Yeah.
Is that so? The Moderna can be 30 days outside the refrigerator. What about the Pfizer?
Yeah. So Moderna can be 30 days in the refrigerator.
In the refrigerator.
In the
yeah.
fridge,
Okay.
Yep.
Yeah. And then once you go into that vial, there's 10 doses or 11 doses in the vial, then it's got 6 hours. So yeah, it's really good to, important to coordinate and make sure you're going to use all those doses, which we have.
Yeah.
And Pfizer is the ultra cold.
Yeah.
So that's the one that's, and we, trying to think, I think that is a few hours outside of the freezer, but I don't know the exact details
outside the
on
freezer?
that.
Wow.
Yeah.
Wow.
Because it's the one that has to be
it's ultra low.
reconstituted, right? It has to be reconstituted. So yeah, we didn't get into that.
Did y'all had a choice between the two there?
Well,
it was choices to buy the fridge or not, right? For the most part.
The choice, those that invest in the ultra cold freezer, which I think they were they're pretty spendy, first of all, close, I think north of $10,000 a piece. And they were really hard to come by because, some of the hospital systems purchased those. So we were always going to wait for the second vaccine, and it came pretty quickly. I mean, they were only a few weeks apart.
Yeah.
So.
And then the Johnson & Johnson should be
soon,
summer probably.
Ish. Yeah.
Oh, I think it'll be before that.
I think it's spring.
Before
it's going to be in the spring, or maybe sooner. But yeah, I think
March.
Yeah.
I don't know. I think they're close.
That's spring here in Texas. That's what.
Yeah. So you guys are still in Texas. So you guys are all still in the same location. I came out to your facility there.
That's right.
Yeah, I remember. We came out for a JAD session.
Yeah, no, we're still
in
here.
the same place. Yep.
Yeah. We have staff that are remote and bouncing back and forth, but we're all still here. That's where we're filming from. We're in the not the basement, but the first floor of that building.
Yeah, we set up a little studio down here. In that. Yeah, I saw where in the UK they're experimenting with giving people multiple different versions of the virus.
I heard that.
The vaccine.
With the vaccine.
Like mix it.
Yeah, they're giving them multiple versions of the virus too there because that UK variant
That's
came
just
out.
happening naturally, right?
Yeah. But they're
America.
experimenting with different combinations of the vaccinations to see what the protection is, which is interesting.
Right. Like if it's going to increase the protection.
Right. Well, they're trying to see, can I get the same protection from two different ones as I get from two same? Right. So could I get a Pfizer, then a Moderna, or Moderna and then a Johnson & Johnson? Or
what's the data on it? Did they have any data yet?
The preliminary looks pretty good, but it's just preliminary.
Oh, I gotcha. Wow. All right.
So it's all very interesting and probably be here for a while. That's we're working on some stuff to be able to import your stuff out of your jot forms right into Pioneer, so you don't have to hand enter all that.
Right.
And that's probably going to be a month, but
that'd be great.
Yeah.
But it'll all be. I think we're going to be doing this for a long time. I think it's shots and then it's booster shots, and oh my goodness, I can't imagine what it's going to be when it's everybody. Right now it's just 70 and older. I mean, how are they going to do when it's general public?
Yeah,
and you have those kind of lines and that kind of people who want it. How do you right now you're kind of being able to differentiate and narrow it by being an age, but at some point it becomes a really big group, and people are frustrated because they can't get registered, and jot forms is crashing because too many people are trying to hit at the same time. And
you'll just stay booked for a while. Right.
I think initially, and even like now, and we're bumping down to 65 on Monday. 65 and up are eligible, and then also teachers and childcare workers are eligible starting on Monday, which will be great. And that's another area I think that we're going to be able to grow, and as far as being assigned schools, so they're working on that at the county level too, so that different providers are assigned schools. So that's pretty it makes sense. But I think it'll be that initial frenzy, right? When as each phase opens up. And so then I think it looks like clinics initially.
Okay.
Because you almost have to, right?
Yeah.
Right.
Otherwise you're just not.
Otherwise, your parking lots.
Do 20 to 30 a day is not going to make much of a dent. So I think those clinics, and then once that initial kind of frenzy is over, then just work it into the workflow. And
you guys were super prepared, though. I feel like, right? You guys had, I say prepared, was anybody, but already had like testing. You're already doing testing, weren't you? You have a really strong immunization program already in place, I feel like. And
we definitely had the immunization program. We've done immunizations for so many years. We did immunizations before pharmacists. I mean, this was even when we would hire nurses to do it.
Okay.
So that's just something we've always focused on, and it grows every year. And with the testing, we partnered with Health Mart initially and did the free testing with them, and and we had a couple of the BD Veritors.
Okay. And
so we worked with that company and were able to get a hold of some assays or the tests, and have now shifted from the the tests that took 4 to 5 days to get the results to those rapid tests. So our community just really needed another source for somebody, for another provider testing. So we've been doing that, and we're still doing that. So at our Greeley location, we're doing testing and vaccination. So we just have it depending on the day.
Wow.
We just change out our signage.
How has the flu season been? I was at a pharmacy this week, and they were like, last January they did 70 Tamiflus, and this year they did 0.
Well, definitely flu is not as prevalent.
Right. Yeah.
Right?
Yep.
And that, no surprise there, right? I mean, as far as just the social distance, the masks, everything. So, but we did, I'm trying to think what our increase in our flu.
I bet flu vaccinations in 2020 were huge though. Right?
Yeah, it was one of our goals though. So we really set,
Nice.
we set an intentional goal around that. And I think we were up, I want to say we were up 30% in our immunizations.
Wow. All right.
For that time period, we measured September 1 through October 15th was our time period.
Any kind of play on these people who are coming in for the COVID vaccines? Are most of them your customers, or are they non-customers?
No, they're mostly not our customers. So we see that as an opportunity to just, again, introduce us, and they do get that exposure with our team. And again, it's been very well received. And we have information we give them about our pharmacies. We cover Northern Colorado, so even certainly people are driving. They'll drive 2 hours to get a vaccine, but we have good coverage up in Colorado. So we just want them to, we want them to know where we are and just all the different things that we can partner with them on, not just prescriptions, but we deliver. We have the clinical services that we offer also. So there's just a lot of things we can do to help them with their health.
So you guys are actively doing a little bit of education, as much as you can anyway, with every kind of new patient you get to meet in those vaccinations piece.
Yeah, and it's mostly around the vaccination. There's a lot to communicate to them.
That's true.
About, what to expect, their second dose. I mean, all that. So it's mainly focused on that, but they do get exposure to our pharmacists and our technicians at that time. And then we just have a little handout we give them about us, where we are, kind of some of the other things that we do.
Oh, well, the other vaccines. It seems like the first opportunity there would be to talk to them about Shingrix or
something.
pneumonia or the other kind of vaccines that do they have or could they get?
Yeah. And we try to do that definitely during flu season, for sure with the pneumonia. And Shingrix is a little different. You need to kind of spread that one out. But I think it's just more and more pharmacies are seen as the place to go for immunizations, whether it's what you need for school or travel, that kind of thing. And then, of course, with the COVID testing and just the point of care testing, which has been kind of slowly ramping up in pharmacies. I mean, that is going to be kind of the next thing for pharmacies, and just similar to the way immunizations have increased over the years. Just being able to go into the pharmacy, get a strep test, get an A1C test, just get that feedback right away.
You think that's here to stay?
Oh yeah. Yep. Yeah. Absolutely. I think that's the next big thing.
Yeah, I do too.
So tell us about you. You're a skier. What do you do for fun besides pharmacy's fun, obviously, but
yeah. Definitely a skier. So I grew up, I'm in Colorado by way of Iowa. So I went to school in Iowa City, University of Iowa, and did a residency there at the hospital. It's kind of funny. I found an essay that I wrote in high school when I was in 11th grade about how I wanted to work with my cousin. So my cousin and his wife are both pharmacists.
Oh, cool.
And they're my partners.
Oh, wow.
So, and this is like, I almost like, seriously, this is really what I wrote. So that I wanted to work with my cousin, and because he knew a lot of people and he was well connected, and I wanted to work with him someday. And I swear I don't remember that. So it was just one of those fun things to go back and find, and very, foreshadowing, right? I mean, that's where I am today. And
is that David and Nancy? Is that?
Yes.
Yeah.
Yep. Dave and Nancy Lamb.
Yeah.
Yes.
Yeah.
Yep. And so that was, gosh, I'm on my 29th year with Good Day. So,
wow. So you were in the hospital setting before?
Yes.
How did Dave get you down there?
Well, it was the skiing really that got us here.
Okay.
All right.
So the skiing and just,
Where do you like to ski?
So we ski at Summit County. So my favorite is probably, I love Beaver Creek, but I really like Keystone. Keystone's really fun. So that's where we end up.
So when you go far, but Summit is near you? Is that?
It's a couple hours.
Summit County?
Couple hours.
What is that like?
Summit County. What is it like?
Yeah, if I come visit you, where am I skiing?
Like where? Yeah, or where is that in relation to
let's just
Steamboat?
cut to the reality.
Okay.
When I come see you, what's in it for me?
What's Summit County like?
We share a home with some other families up there, so we do get up there on a regular basis, and it's really a sweet deal when you have kind of like a timeshare, but like our own
not a
little
formal
timeshare.
one, right? Yep. Mm-hmm.
Right. Yeah. So Summit County is Vail, Beaver Creek.
Oh,
okay.
I got you. Okay.
Yeah.
Okay.
That's
so
not
that's
far
Summit County,
from.
and then of course Winter Park, Steamboat.
Right.
Steamboat's.
But that's pretty good
further
ways from
away.
you, right? You're in North Colorado, so if you're
It's a 2-hour drive.
that's not bad.
That's not bad.
Yeah, my wife's sister lives in Eagle.
Yeah.
Oh, great. Yeah, that's right up there.
Beautiful over there too. Are you a black diamond skier? I'll tell you, I'm a solid green skier. Like
Solid.
I can go down a green.
I'm a triple
really
diamond
good.
green skier.
Right, I'm a triple diamand green skier. Bunny slope.
I like the cruisers too, Mark. I like
really
the
do.
blue cruisers, and I like the ones that have the bumps, the moguls just on the edge.
Okay,
and
yes.
Go in
hop out.
kind of like test the water and then slide back in.
I'm usually at the level of whatever the youngest child is with us, and so I'll usually go with them, and they usually want to go in the kind of like I don't know what you call it, but it looks like a skate park to me, like in a kind of
park.
and we'll go in there and I'll fall but I'm also the guy that's on a paddleboard falling like 30 times, and everybody's like, oh, Mark fell again. So.
Well, and you skied some right out of college, but really his real skiing has just been the last couple of years.
Yeah. It's good. I'm the anchor of the group.
So do you guys get out? Do you guys get out to Colorado?
No, we usually go to Big Sky, Montana.
Usually Big Sky over here.
Big Sky's lovely.
Yeah, there's the Montana Pharmacy Association has a show there early January.
She knows Mike and them. Didn't you Mike Matovich and them?
Oh yeah. You know Mike.
Yeah, and usually at that State Pharmacy Association, Jeff and Marcia usually go to that one.
Yeah, Montana was the first state out of the original traditional states that New Tech computer systems had that we had pharmacy systems in, and probably 70% of pharmacies in Montana have our software.
Oh, that's great. That's awesome.
So we go up there every year and we'll ski with them a little bit. And last couple of years, Mark's come down before
with the kiddos. And they're already better than me.
And that's their thing, right? You ask them.
That's how it should be.
You ask them where do they want to go on vacation? It's like skiing.
Yeah. It's definitely a young person's sport. I'm like down. I'm cruising on my green, right, and I'm like, I see these like 11, 12, 13-year-olds just flying through the woods, not even through like the actual ski trail, just flying through the woods. I'm like, I can't do it.
Well, some of that is you have to learn to be afraid.
Yeah.
Sometimes there's a kid age where they just go, and sometimes skiing you just got to go.
Yeah.
You just got to hit the I believe and put it back together when you get at the bottom.
I'm good. I'm good for a couple of Marcia and you, I think, call it yard sales, but yeah, I'm good for a few like. Everything's gone. Like I've got to go grab everything. At least a couple of those.
Man, first place I ever skied was Vail.
Oh, nice.
So
yeah, I really work hard on not falling. That's just you don't want to fall as an adult.
No, you don't. It hurts so much more. It hurts so much more when you're an adult.
It's one of yours. I think it's a good goal. Don't fall.
Yeah. So I have a question for you guys.
All right. We're going to do a reverse podcast. Here we go.
I love it. I love it when people come with it. She's already got a feature done. Like, I love it.
So, we have the retail pharmacies and have had PioneerRx for, going on 4 years now.
Yeah.
4 years this summer. And Jeff, I think you and I have kind of messaged about this is, we have a closed door pharmacy, which is a closed door pharmacy is a great business. And yeah, I'm just kind of curious about what that looks like for PioneerRx, especially now being under Red Sail and kind of with PS1 and Integra and what that looks like for that part of your business. Is that something what does that look like for us?
Some of that on long-term care is just really looking at the long-term care. We certainly have long-term care that's not a good fit for Pioneer. Pioneer was designed for retail pharmacies that are doing long-term care.
Also
doing long-term care. So some of the things, and we're, one of those kind of things you kind of sell against yourself. Prime Care is a good long-term care product, has a lot of features in it. Depends on what of those features you're using.
Yeah, and a ton of connections too.
They're rebuilding that product as a cloud-based product right now, supposedly making good headway. We're also continuing to improve our long-term care, especially for people who have Pioneer. The pharmacy I was in 2 days ago has their long-term been since 2018 converted from QS1 to Pioneer Retail and Pioneer Long-Term Care, and he's killing it. But he's doing a lot of patients in home. He's doing a lot of assisted living. Not places where I have the home.
Yeah. Okay. But not a lot of skilled beds or hospice, I guess.
Yeah. Some of the things and we can talk about some of those. One of the ones I want to just sit down with you and look at it and see.
Sounds good.
How that makes sense, especially you being central right now. There'd be some benefits. We certainly have some large groups, Lewis Drug, who their long-term care closed shops are using Pioneer, their own central, plus their other. It depends on what MARS the homes are using, what EMARs they're using. There was a while it was hard to get the EMAR. It's kind of chicken and egg.
Yeah.
Well, you don't have this home, so we're not going to program to you.
Right.
Well, he can't get the home unless you program to us. A lot of that kind of chicken and egg stuff.
Sure.
You'll be happy to know we're actively working on web-based central reporting. So
great.
Hopefully that's sooner. That's been a long time coming there on the central side. You did say you went to central for your stores?
Yeah, we've had central from the beginning.
And, but you went with central fill.
Yeah, we have.
Oh, central fill, yes.
Is that what?
Yes. So we have a central pharmacy that we're mainly filling day packs. So we're doing the multi-dose packaging out of there and then so we're filling it there. We've got a Parada Pass there and actually have a second one coming. And then those we package and then send back out to our pharmacies.
Okay.
Nice.
So
and they're delivering out to pharmacies. What are y'all using? Partner network? What kind of technology are y'all doing? Are they filling it in the?
They're using the shared inventory, I think, if I remember right.
Yeah. So we have the inventory. We have inventory in central, but yeah, you're right. I think Mark, we are using shared inventory, but it is filled using the pharmacy. So using the child pharmacies.
And then
everything processes through there, and then it gets sent back out to the pharmacy. And it just really is going to free them up. We started with Distill, and that was pretty labor intensive for our locations. We knew that we know that it's a need out there in the community, home health, and just, again, keeping people independent as long as possible. But it was also a lot to ask of our stores, a lot to ask of our pharmacies. So moving to a central model where we could take that labor off of them and use automation, freeing up time for them to do more immunizations, point of care testing, clinical services. And
do you have a percentage goal? Are you going to mainly drive MedSync out of there, or?
Well, it's got to be MedSync with strip packaging.
Oh,
probably,
yeah. So they have to be MedSync first.
Right.
And yes, of course we have a goal.
Of course. That's what I know. What's the goal? What kind of percentage are you trying to drive to the central fill?
Yeah. Well, so the goal for the year, our overarching goal is the 25% patient growth, but we have a day pack goal of 1,000 day pack patients by the end of the year.
Nice.
Okay.
So
how does that compare to how many sync patients you have?
I know. We just
I'm
keep.
her,
I know.
just throwing it.
Next time she's like, I'm gonna have my dashboard up next time.
It's like I got all these numbers right here. Just you keep coming. I
know. We can't stop her yet.
That's
all right.
Yeah, I don't know. I'd have to get back to you on that. I don't know what our total. I mean, our MedSync total is 4,000.
Okay.
I'm pretty sure it's around 4,000. So I guess
Nice.
25% of that. But we really shoot for each pharmacy to be at 50% or more of their fills to be synced.
Nice, killing it.
Yeah.
Do you feel like that is the main driver for you to layer on all of your clinical services you're doing?
Yes. I mean, it's as much as it helps the patients be adherent and helps them, just again, be able to have what they need and stay on top of it. As you guys know, and most people, that MedSync is such a key for inventory control,
right.
for workflow, for the phone ringing,
Right,
yeah.
or not ringing.
Right.
So yeah, and then to your point, with that time savings that you have, not being just in this reactive state of answering the phone and then writing down 10 scripts to fill. Then there is more time to do these other services, and the day packs will even be that next level.
Nice.
Next level of pulling that work out of the community pharmacy.
So are you buying more stores?
Yeah, how did you and Dave even get to 10? Like how does that happen?
Well, it's been a long time.
Yeah,
it's not like been a super fast.
That's
thing.
true.
Are we buying more stores?
Are opening more stores?
We have we have the 11, and then we also co-own 6 other locations that we do operations for.
Okay.
And
they
so
on Pioneer?
those are
Nice.
Yes.
yeah, and those
Were you asking me? Yeah.
Oh,
Sorry, I thought you were
Pioneer.
pointing. I thought it was like a dig at me. I thought that was like a.
Yeah, no, that's been so huge. They didn't have Pioneer, so we transitioned them.
Yeah.
A couple years ago over to Pioneer.
Yeah, they're the more recent ones.
And it's been great. I mean, we would grow if the opportunity was good. I mean, we're pretty picky. We're self-funded, so.
Yeah.
And it just, Mark, to answer your question, we had one. Dave and Nancy bought one pharmacy back in the 80s. We opened a compounding location in the 90s.
Okay.
And then we bought 3 together that we're going, and I mean, so it's just been
this over time, this gradual opportunity presented itself.
Yeah. And we have so Central is actually number 16.
Okay.
So over the years we have sold a couple, and we've combined a couple. So yeah.
All right.
It's been fun.
Are y'all when you were buying them, is it? And the only reason I say is I've heard this more, but did you see an opportunity where someone was like, look, I'm trying to retire and I don't have somebody to pass this to? These are conversations I have, and this is just me trying to get some of Vicki's feedback. Where, hey, I'm trying to retire. We're just at a certain point where some of these pharmacies are in that little bit of a bubble of trying to retire. Either I'm converting to Pioneer because I want to make it more attractive to sell because I want to sell it to another independent. Is that more the case for you guys when you guys bought those 3 or whatever, where someone maybe didn't have somebody to kind of pass it on to, or?
Yeah, we had. I mean, honestly, I think we just had one like that, and it's our busiest community retail pharmacy, and that was a gentleman who wanted to retire and didn't have anybody that was in the wings, kind of waiting to a junior partner to take over. The other ones, we've had a couple physician-owned pharmacies that transitioned from, that clinic-owned to, and it's just them operating a pharmacy. I mean, pharmacy is complex.
Yeah.
So,
if it's not your wheelhouse, it makes sense.
Yeah, we see a lot of our growth from existing Pioneer owners, opening up new stores, buying stores, and converting to Pioneer.
Yep.
The lead source is PioneerRx owner. And it's one of those things when people ask me, well, how is independent pharmacy? Isn't that dying? I'm like, well, the people who know it really well are opening up new stores and buying stores. So the people who know how to run a good business and are involved and connected to their community are doing great, and they're running great businesses. And the people who think they can open a pharmacy and hang a sign or not, you know?
No, I mean, we really rely a lot on, Pioneer and what we're able to see, like when, even just in the middle of filling a prescription, just being able to identify, the DIR fees, just giving us as much information, and also not overloading, right? But giving our teams just things that they can, take action on that is going to, bring a positive impact, So, we're thrilled with what we're able to do and with Pioneer. So yeah, thanks you guys. Keep it up.
What's the, where do y'all need the biggest help today?
We do have a focus on our loyalty program for this year. I mean, that's going to really match up well with our patient growth goal. So I think that is maybe just some work or some, expanding the loyalty program. So I don't know if that's something you guys are looking at, or we've found, and we've never gone to a specific point of sale system that's more like I guess that's what their main focus is. We've always had the pharmacy point of sale system, which has been fine for us. Our stores aren't that large. So yeah, I guess that would be, I'm curious, is there anything in the loyalty program that you guys are working on?
I'd be interested to see. We'll have to connect after this and kind of talk about what your kind of ideas are. We have a deal. We just got a patent
on something, right?
Yeah, which is called community points. It'd be interesting to see what your idea that is. And the concept of, so we had this idea that I'd like to be able to give away points. I want to give away a lot of points, right? I want to give away points because you put your blood pressure in, or give you points for walking 10,000 feet, or give you points for refilling over the web. But in general today, loyalty points are tied to purchases, and they're a portion of your purchase, right? So you buy this OTC, we're going to pull back 1% of it. And so I just can't give away points. So the idea of community points is that a store in a community would say, okay, so this month our charities are high school bands. And so we've got $5,000 we're going to give to the high school bands based on how the points distribute. And so you can, on our mobile app, you can put in who you want your money to go to. And as you generate points, we'll show you a scoreboard. And then at the end of the month, we're going to divide the money based on the points that were generated. And so, you could see the local band saying, hey, go to Good Day Pharmacy and buy this. You get or if you just go inside and check in, you get points. But the idea of community points is that you kind of got a limited spend. It's more of a marketing spend rather than having points tied to dollars. And it also gets around probably some of the government not being able to do government points and things like that. But we just got a patent of that, and that's the thing we're looking at adding to our mobile app.
Okay. Yeah, that's great. And I'm glad you mentioned that, because it is, we were kind of looking at when we set up the loyalty program, could we give points for someone getting a immunization? Right. And, or signing up for MedSync. So, because those are things we want that to be like a driver. So we want that incentive back. We've got a diabetes trial that we're participating in. And so we're going to be, we have a diabetes trial that we're going to be recruiting patients. And then we also have a diabetes prevention program that we're recruiting patients. So anything that can kind of incentivize or reward would be super handy.
What, who's the payer on the diabetes program?
And what is it?
So the diabetes, the prevention program is tied to, it's a state grant.
Okay.
So we're partnered with, there are 10 pharmacies in the grant, and we're partnered with a school pharmacy in Colorado, in Boulder, or actually it's in Denver. And so that, the payer's the state of Colorado. And there's 3 components to it. There's an MTM component. There's a education component for those patients that already have diabetes. And then the one we're recruiting for now is a prevention program. So they don't have the diagnosis, but they have risk factors. And it's a class-based, just again, giving them the tools to not fall into that.
How's that going to be documented and measured?
Well, the the formula or the structure of the classes is pretty set. I mean, that's already, and as far as measured, we'll do A1Cs. So that's, I guess, part of it. We'll do weight, blood pressure, but it's more education based.
I gotcha. I was thinking like e-care plans or care plans.
Yeah, it's like, how are you getting back to the grant authority?
Right.
I mean, I imagine you make a report or something.
Yeah, I imagine you're just
Yeah.
you're mining your own data.
Yeah. So you have the areas, or I guess the measures that you have to come up with and you have to hit as part of the grant. But e-care plans are definitely we're doing tons of those. We're part of Flip the Pharmacy with CPSN, so we're kind of following that. It's all around COVID now, but before that, of course, it was a lot of blood pressure, a lot of e-care plans. So we're really I think we're in a good place there and ready to take that next step.
How is CPSN doing in Colorado?
Good. I mean, we have about 40 locations in Colorado.
Nice.
But yeah, I feel good about the Flip the Pharmacy piece. And, again, it's all based on COVID right now, which is where it needs to be.
Mm-hmm.
I really appreciate that they are able to shift and respond to what is really needed, and very practical applications with workflows and procedures, and just really giving people tools.
Well, Vicki, I think we're close to getting out of time here. So we want to thank you for spending some time with us today. And thank you for
thank you guys.
Running an amazing business and your contribution to your community and your contribution to your profession. And
well, thank you.
We'll have to do a check-in next year on your goal performance.
Yeah, I know. We do now have a follow-up. So
okay, absolutely.
And I got to see, definitely have the guy who's doing your reports, are you follow up with me and see if we can't get your measure on our dashboard.
Okay. No, I will, definitely.
So that your staff can look it up and just see a pop-up and see how we're doing.
Instant gratification.
And
or motivation.
And see if we can't get some motivation going there.
Mm-hmm.
So
yeah, definitely. And you had just to mention, and just a shout out to our teams. I mean, they are young, eager, excited. They are just really forward thinking, and they come up with all the ideas. They really do.
Great.
And so I just get to be a part of that. So
cool.
That's awesome.
Nice.
All right.
Love it.
All right.
All right. Have fun.
Right. Try to enjoy this.
Next time you go skiing, think about me.
Yeah, I was going to say, try to enjoy the snow a little bit before it melts.
All right, Vicki. Thank you.
All right. Take care, guys.
Bye, Vicki.
Thank you for watching the Catalyst podcast. If you enjoyed this episode, please consider liking, subscribing, and or following us. Give us a 5-star rating on Apple Podcasts to help us reach more amazing pharmacy people like you. Follow PioneerRx on your preferred social media platform for the latest up-to-date pharmacy news and content.